Let's make sure that everybody is in the right place. So today we're doing a Healthy Places Index training, data to build healthy, resilient communities. And this is sponsored by the Center for Community Energy and Environmental Justice. So thank you all for joining today. I'm hoping to give everyone a lot of really great information about how you can use the HPI in your work. Let me introduce myself. My name is Helen Dowling. I use she and her pronouns, and I'm the Director of Data Initiatives at the Public Health Alliance of Southern California. I'm also joined today by Paige Dawson and Lauren Halili from Siege. They're also here to support if you've got questions in the chat, particularly related to Siege work and projects, they can pop in and answer it. If you've got questions related to the HPI, you can also feel free to drop those in the chat. There'll be a Q&A portion at the end where I'll try to answer those. So I work at the Public Health Alliance of Southern California, and we're an active coalition of 11 local health jurisdictions on a mission to mobilize the transformative power of local public health for enduring health equity. That's a little bit of a mouthful, but what does it actually look like in practice? Well, we have three key initiatives that are kind of cross-cutting: health equity and justice, data, and climate and health. And in fact, I'm also joined today by Savannah North, who is our Director of Administration and Climate Initiative. So if you have any questions about the climate work that we do at the Alliance, please feel free to reach out to Savannah. I'd love for you to know more about the kinds of work that we do, and you can also get on our mailing list to learn about some of our new initiatives and learn about how you can get on our mailing list, learn about job openings, all that fun stuff. So you can access that on our website. The link is here. And before I get too far into this, let me go ahead and share a link to this presentation so everybody in the chat here can access to it. I will also share this link out after the presentation as well. So if you don't grab it right now, you'll have access to it later. There's lots of resources in here, not all of which I'll have an opportunity to go in detail for. So keep a link to this presentation handy so you can dive deeper when you have an opportunity to do so. Okay, so I'm going to start out big picture, and then we're going to narrow in on the Healthy Places Index. And I want to start by asking folks a quick poll. Have you used an index tool before? So let me launch the poll. So two-parter, if you've used an index tool before, I'd love to know which tool or tools you've used as part of your work. I'll give folks about 10 more seconds to answer. Okay. So I'm going to go ahead and close the poll. And what I'm seeing is, and I'll share the results out so folks can see. So the majority of you have already used an index tool as part of your work, and I'm delighted to see that many of you have actually already used the HPI. Other really common tools are Cal EnviroScreen or CES and CDC's Social Vulnerability Index, along with USA EPA, EJ-Screen. All right, so helpful context to kind of know where you're at in terms of using these index tools. So you might be asking yourself, why would you use an index tool? How can they help us? So we believe that these indices are useful tools that can be used to systematically, and that's kind of the key part, systematically identify needs, prioritize actions, assess progress, and support credible and inclusive policies. And there's lots of reasons why you might use an index tool. One of them is to support your decision making. So identifying and comparing relative need, directing resources and funding to areas in greatest need, and a little asterisk there under greatest need, and we'll talk a little bit more about how this plays out in different index tools, but every index tool actually defines need differently. Make sure you understand how that tool is defining need. You can also use index tools to help inform your program planning choices. You can use it to engage stakeholders because it becomes a clear method for identifying priorities so that you can easily share out with other folks. And along those same lines, it supports transparency and prioritization criteria. So these index tools are publicly available. The methodology is typically made public, ours certainly is, so that when folks are asking questions about how you made the decision, you can say, we use this index tool and it's fully documented. Our approach here is not only transparent, but also systematic, because you can use that tool across lots of different decision points. So how do you know which tool to use? Because there are quite a few of them out there. Well, I want you to first, instead of thinking about the index first, think first about the priorities and goals of your work. This is the most important part. What are you trying to achieve? And when you've identified that, pick the index that most closely matches the framing lens of your work. What does that mean? Every index comes at identifying either disadvantaged or priority communities in different ways. They take a different lens, a different perspective for identifying need. And what that results in is that different communities rise to the top based on how that need is defined. So what you want to do is closely match the kind of work that you're planning on doing with the index. Make sure that you're using and you're thinking about need in the same way. So how does this play out across these three different tools that I'm highlighting here? CalEnviroScreen, Social Vulnerability Index, and Healthy Places Index. Well, first, it's helpful to know why each of these tools was developed. So CalEnviroScreen has a very explicit environmental justice lens. It was designed to identify communities most burdened by pollution, has a very explicit pollution lens. And in fact, a community doesn't pop up as most disadvantaged if it doesn't have any pollution burden, which makes sense. So this is really best for projects that are around addressing pollution, reduction, and mitigation. CalEnviroScreen would really be the right choice in that circumstance. The Social Vulnerability Index, and this is something that's widely used, but folks often don't know the context for what the SVI was designed for. And what it was designed for was disaster preparedness and response. As a result, the indicators in SVI really focus on housing stability, right? Because stable housing is really important when you're talking about emergency response or identifying those places that might be disproportionately impacted by things like hurricanes or severe weather or things along those lines. So it's really because of that strong emphasis on housing and because it was designed with this disaster preparedness and response lens, it's really most useful for emergency planning and housing programs based on the indicators that are included in it. Now we come to the HPI. HPI really works to capture community conditions that are linked to health. So it considers a broad range of social and economic factors, and it frames issues through community health and living conditions. It's really most appropriate for programs and proposals that are impacting the social determinants of health, those community conditions that we know are linked to health. So how do you pick the right one? Well, first, as I said, consider your program's specific goals and desired outcomes. Make sure that you are looking at index methodologies to understand what issues are measured. Make sure that kind of aligns with the work that you're doing. Also, engage stakeholders on their priorities and concerns, because that too can help make sure that the index tool that you're choosing is reflective of community need. And of course, choose the framing that is most aligned with your work and messaging. This is a small or not so small point about the HPI, but HPI actually uses a positive and asset-based frame. We don't identify disadvantaged communities in the HPI. We prefer to call them priority communities, places that have the best opportunities for improvement. And that positive and asset-based framing is very different from what a lot of other tools do. And I'll show you that more when we get into a demo of the HPI. Okay, so let's go back and say that you have decided that HPI is the right tool for you to use as part of your work. And I want to start in talking about the HPI. I want to start by sharing our value, which is that everyone deserves a healthy life. But we also know that to make this value a reality for everyone, we need to understand what makes us healthy. It turns out that it's all about where we live. So community features like safe and stable housing, opportunities for higher education, access to good jobs, and healthy air and water quality all contribute to longer and healthier lives. People who live in well-resourced communities are less likely to experience chronic health conditions like diabetes and heart disease, as well as be deeply impacted by infectious diseases, as we really saw quite starkly with COVID-19. In short, we can't afford to ignore the role that community conditions play in shaping our health. And because these conditions are influenced by policy and funding decisions, if we create mechanisms and allocate resources to build better schools, create jobs, support basic income pilots, construct affordable housing, and more, we're also ensuring the essential conditions for good health. I recognize this might be a little bit of a tall order. Where can we find opportunities to build healthier places? We'd like to think that HPI, or the Healthy Places Index, is a great jumping off point to do just that. So let me give you a whirlwind orientation to the HPI. So HPI is a powerful tool for improving health equity in our communities. And it's not just one thing. So our HPI platform has 3 components. I'm going to walk you through what each of those are. The first is the index itself. So this summarizes neighborhood level data on community conditions correlated with life expectancy at birth. So here is our complete list of what we call our policy action areas. These are sort of thematic groupings of indicators. And each of our indicators that make up the overall HPI score. You'll also see that there's a little number under each of our policy action areas or thematic groupings, and that actually corresponds with how much that group counts when we are calculating an overall HPI score. And it's typically reflective of measures that are more strongly correlated with life expectancy at birth. So these are indicators that are strongly linked to health. Every indicator in the HPI is correlated with life expectancy at birth, which means that if you were to improve any indicator in the HPI, like tree canopy cover, high school enrollment, voting or responding to the census, we would also expect to see down the line improvements in life expectancy as well. And all of our methodology, hold on. And all of our methodology for the Healthy Places Index is available on our website. So there'll be a link to that in the presentation, and you can check that out if you want to know more about how we construct an HPI score. All right, the second piece are our policy action guides, which provide a wealth of evidence-based policy recommendations to move data into action. It was really important for us to not just quantify where there are opportunities to improve community conditions, but to actually give folks the tools that they need to find the policies that they might be able to implement to actually move the needle on these indicators or on these community conditions. So we actually have these in-depth policy guides associated with every indicator in the HPI that tells you how it's connected to health, as well as dozens of policies and recommendations for how you can move the needle on each of these individual indicators. This is an incredible resource. You don't even have to use it with the HPI proper. If you're just looking for ideas on how you can improve any of these measures of community conditions, check out our HPI policy guides. And we can go ahead and add a link to that in the chat. Finally, our interactive map. So our map actually brings together all of these components in one place. So our index data, our policy action guides, as well as a lot of supplemental data on community context, things like health outcomes, measures of racial equity and demographics. And we also have a lot of other advanced spatial analysis features to help you make the most out of these data. Okay. Before I do a map demo, I actually want to introduce folks to interpreting HPI scores because it can be a little overwhelming at first. So let's break it down. If you go to the HPI map and you click on a neighborhood, the first thing you're going to see is something that looks a little bit like this. And let's break down what each part of this is. First, HPI score. So this is telling you what indicator or measure you are currently looking at. In this case, HPI score, which is our composite measure of those 23 community conditions linked to life expectancy. Then you're going to see this 3.0. I think this is a little bit confusing, so I want to point this out. This 3.0 tells you that this is the version 3.0 of the HPI. So specifically, this is the version number. So you'll see this all over the place when you're looking at the HPI score. You'll see HPI score, parentheses 3.0. That just tells you that you're looking at version 3.0 of the HPI score. We actually have older versions of the HPI available to view on the map as well if you want to see how things have changed over time. And then importantly, this 20.5 percentile. All right, what the heck is a percentile? This is basically how this neighborhood ranks compared to other communities in California. We can say that this neighborhood ranks higher on the HPI score than just 20.5% of other neighborhoods. Conversely, it ranks lower than 79.5% of other neighborhoods. So that's if you, for example, if you basically subtract 20.5 percentile from 100, our rankings range from 0 to 100. You can see that that's where it falls in the spectrum. So it's lower than about 79.5% of other neighborhoods. But largely, you just want to look at this percentile, and this will tell you what quartile this community falls within. Well, what's the quartile? All right. We divide our percentile rankings into 4 quartiles. So communities in HPI quartile 1, so the 0th to 25th percentile, have the least healthy community conditions. And then communities in HPI quartile 4, on the other end of the spectrum, those are those places in dark green on our map, 75th to 100th percentile, have the most healthy community conditions. So our map tool shows communities broken down by quartile. So it's easy for you to quickly spot communities in the highest and the lowest quartile. And really your takeaway from this is that places with HPI scores that fall within quartile 1, so those communities shaded in dark blue, are our priority communities. So when you're making program planning, evaluation, or resource allocation decisions, you want to focus on those neighborhoods. HPI quartile 1, places in dark blue, are priority communities on the Healthy Places Index. We also provide indicators beyond the HPI score. So our HPI score, we don't show you the HPI score value, we just show you how it ranks. But for indicators that make up the HPI score, we also show you the indicator value. This differs from the percentile rank. So for example, if you see this employed indicator, you'll first see the value and then you'll see the percentile ranking. So in this case, we have a value of 84.2%. It's the value of that indicator in this neighborhood. It means that 84.2% of the working age population has a job. This differs from the percentile rank because that just tells you how this indicator compares to all other neighborhoods in California on this specific indicator. So we can say that this neighborhood ranks higher on the employed indicator than 94.1% of other neighborhoods. But if you actually want to pull that value, the actual proportion of the working age population with a job, that's also available here too. And I wanted to point this out because you might want to use some of this supplemental data that we provide in the HPI beyond the HPI score because it can provide additional community context in, for example, your grant applications or your project proposals. There's a lot of data in the HPI that you can pull from one place to be able to characterize the communities and the populations that you're trying to serve. All right. So I think it's always better to see this stuff in action. I've been talking at you for a little while. So let's actually go ahead and dive into the map itself. All right. So this is what the HPI map looks like. And I want to give you a quick primer on what you're looking at. So first, the map is loaded at the neighborhood level. That's what we visualize things at here. It's also known as the census tract. Areas in light and dark green are places that have healthier community conditions. That is access to better jobs, better housing, cleaner air and water, more educational opportunities, and all of those other factors that we know contribute to better health. Conversely, places that are light and dark blue have fewer health supportive community conditions. And if you ever get confused about this or just need a quick reminder, take a look at the legend. So from dark blue to dark green, we're going from less to more healthy community conditions. And remember, those areas in dark blue here, HPI quartile 1, below the 25th percentile, these are our priority communities. So what I want to do today, I'm going to demonstrate how you're going to find a community, interpret the HPI data that we have here, and then we'll put that data into action by talking about how you can use HPI in grant applications. Okay, so there are a couple of different ways you can find communities on our HPI map. The first and most obvious is you can just zoom in. Works like any other mapping tool. If you know where your communities are, you can just go ahead and zoom in. So like, let's see where we want to look, somewhere near downtown San Diego. So we can click, let's see. I used to live in this census tract. So we'll just pick on this one. So that's here in Golden Hill in San Diego. So if you know what community you're looking for, you can just zoom in and click right on it to get more information. But maybe you don't know exactly where a community is, or you want to look at a larger area. And let's say that I am interested in, I'm going to search for a particular city or town. So I want to look at National City. You can also search for a specific address as well. So we're going to go to National City here in San Diego. And this is really important, and I think it can be a little tricky. If you search for anything other than a specific address, like a city or town, a zip code, a county, the map is actually going to reload at that level. So I search for National City, which is a city or town, and the map, instead of being at that census tract level, it's now popped up to the city or town level. This can be helpful if you kind of want a bird's eye view of what community conditions are in a larger area, but really wherever possible, you want to be using the census tract, so that neighborhood level, because larger geographies like zip codes, cities or towns or counties can really hide a lot of variation in community conditions. And also, many grant programs and funding opportunities are really looking at the census tract level. So if you search for a city or town or a zip code, go back into the legend. It'll tell you what geography you're currently viewing. And in the drop-down menu, click tracks. So now we've been brought back down to the census tract. And you can see that, yeah, there's variation here, both light and dark blue communities. Okay, so you found your neighborhood. Let's talk about interpreting HPI data. All right, so if you click on a neighborhood, first you're going to be shown that HPI score. So I showed you this earlier. We can interpret this. So you see this is HPI score version 3.0. You can see that up here too. And this community falls in the 19.4 percentile. We give you a little graphic that matches the legend that tells you where this community falls on the spectrum of less to more healthy communities. It's dark blue, so we know it's an HPI quartile 1, and we can see exactly where it is with an HPI quartile 1. And you can also see how it compares to the city or town average. So here's their city or town average. So it's actually below the city or town average. And we can also see that it's well below the San Diego County average as well. So this gives you context for how this neighborhood fares compared to the city that it's within, as well as the county that it's within. And we can see that this tract has healthier community conditions than just 19.4% of other California tracts. In other words, it has less health supportive community conditions than about 80% of other California tracts. We also give a little bit of information on where this community is located. Importantly, so keep an eye out for this, we do provide the tract ID. So when you are filling out your grant applications, you may need to specify the tract ID of the neighborhood. That's where you find this. It's available here. You can also see it in the little tooltip that pops up, the data probe, when you hover over that community. You can see that's the first item that you see, tract 117. So make sure you note that down because you may need that for your applications. We also give you the population for this as well. So we have about 6,000 people that live in this community. Then we show you our policy action areas. And you can see how each of the policy action areas compares. So we can see, for example, that our policy action areas like neighborhood, potentially clean environment here, these are looking compared to the rest of California, these are really not too bad. Measures around economic, transportation, healthcare access, housing, these are closer into the quartile 1. So that suggests that there are probably some opportunities for improvement here. Let's take a look at actually the individual indicators that make up each of these policy action areas. So this kind of gives you just like an overview of what those individual indicators might look like, but it's really helpful to actually expand each of these policy action areas and take a closer look. And we can see here that it's pretty consistent in economic, above poverty, employed, per capita income. These are all really first quartile. These all represent opportunities for improvement. Remember, for our individual indicators, you can see both the value as well as how that value compares to other neighborhoods in California. That's that percentile rank. So for example, with per capita income, you can see that the per capita income in this community is about 21,000. And then how that compares to the rest of California is that it's higher than about 23%, 22.7% of other California communities. So the first measure that you see here is the actual value of this indicator, and the second is how it compares. We can look at education, and we can see here that we've got, so bachelor's education or higher, that represents an opportunity for improvement, but high school enrollment is really quite good. Let's take a look at our neighborhood measure. So this is really interesting. It's also why you should always kind of drill down into the individual policy action areas, because once you get to the individual indicators, you can see there's quite a bit of variation even within this one thematic group. So we can see that retail density is great. Retail density is a measure for jobs. So there's access to quite a few jobs here. Maybe, I'm starting to see a little bit of a narrative in this community. While there might be a lot of jobs, based on the per capita income, the folks that are above poverty, there might be an issue with living wage here. So we might have jobs, but they might not be paying enough for people to get by. But we also see our tree canopy coverage also represents a good opportunity for improvement. And our park access measure is actually pretty good as well. So about 95% of the population here is within walking distance of a park. There's a lot to explore here. I highly recommend just taking a look at some of these different measures and seeing how it stacks up maybe in your own neighborhood and identifying, okay, is this really representative of my community? What's missing here? Is my daily experiences kind of captured in this? It's really helpful to just take a look at your own neighborhood and see if the data are really reflective of what your experiences are. Now, you might see some measures here that you're not quite sure what they mean. Like, for example, our low-income homeowner and severe housing cost burden measure. If you have any questions about our indicators, including where they come from, what years of data they use, just click the little arrow next to the indicator. And you're going to get more details about this measure. So you're going to get a big graphic that tells you how this compares to other communities in California. And then you get a breakdown of what that actually looks like. So it gives you the value and the percentile rank. If you want to know what this is actually measuring, it tells you right here. What does this indicator measure? So the percent of low-income homeowners who pay more than 50% of their income on housing costs. At the bottom here, I want to point out we actually have some more technical information here. So for some of our indicators, they might be a little bit more complicated. So we provide a more in-depth technical definition of the indicator. We tell you where the indicator came from, and we also provide the year of data. Now, there's often a lag between the data year of collection and when it's actually made publicly available for us to use on our map. So while the year of data might look like it's a few years out of date, it may not have been available to us until just a couple of years ago. So keep that in mind. But you can see the data source and the year of data here. And the other piece that I want to point out here is our connection to health. So for those of us who work in public health, how things like housing cost burden, how that's linked to health, I think we understand. But for folks who are working in other sectors, or you're in a community-based organization or an advocacy group, you might not know exactly how this can impact health outcomes. So that's why we provide this connection to health. So for the low-income homeowner, severe housing cost burden, we tell you that all residents should be able to afford adequate housing without giving up healthy food, medical care, or other necessities, or accepting unsafe housing conditions. So this helps really bridge the gap to help you better understand how these measures are linked to health and how to communicate it to other people too, if you're building a coalition to really make big changes in community conditions. And so you've seen this measure, and we can see this really represents an opportunity for improvement. Well, you might be asking yourself, okay, how do we actually move the needle on low-income homeowner severe housing cost burden? Well, that's where our policy opportunities come in. I showed you that separate website that had our policies, but we also build them right into our map too. So if you click on policy opportunities, you're taken directly to the policy guide for this indicator. We also provide a much more in-depth version of our connection to health text. So that gives you a little bit more context for that connection to health. We give you a little jumpstart guide here. So what are the policies that you might want to focus on first to address this indicator? And then you can go down and navigate each of the individual policies here. So all of that information that's available on the standalone website, also available right within the map. So you can go from, okay, I've identified this community, it's a priority community, and I can see that measures associated with housing cost burden are ones that really represent an opportunity for improvement. What do I actually do to move the needle on it? And you can use our policy guides to really get those initial ideas for how you might impact this community condition. So we go from being able to figure out what's really impacting health outcomes in this community to identifying pathways for action. So we really kind of cover the whole spectrum. It's very important for us to provide not only the data, but those opportunities for action as well. Okay, so let's go back to the main panel here where you're seeing our HPI score. We looked at some of our individual indicators. And we also provide some other important contextual measures. So things like our racial justice and health equity measures, which can provide really important context for the populations in this community. So for example, we can see here about 26% of this community identify as Asian alone, about 57% Hispanic or Latino, and white alone about 12%, with Black or African American alone at 3.5%. And you can also see that broken down here. Now, this is good information if you are developing an intervention where you might be interacting directly with community members. It can give you, one, kind of tell you more about the neighborhood dynamics, but two, can help you decide, okay, who are the key messengers in this community? What community-based organizations or advocacy groups might I want to reach out to that really is representative of the community? And categories like Asian alone, unfortunately, is really far too broad. It covers a lot of different ancestries and backgrounds. That's why we actually provide a breakdown of where folks in this community say that their ancestry is from. So for example, while you can see Asian alone, 26%, we're seeing that the vast majority of these identify as Filipino, with about 1.5% Japanese. So this tells me that if you were planning to do a community intervention here, you might want to provide data or provide outreach materials and messaging in languages that are spoken in the Philippines, because a large proportion of your Asian population here, which makes up about 1/4 of the tract, are from the Philippines. We also provide this breakdown for Hispanic or Latino of any race, and you can see that there's also a diversity of folks with Hispanic heritage. And we also provide tribal information affiliation here as well. So this is really good context to understand beyond community conditions about this neighborhood. And we also have some measures of equity. If we have data on whether this tract was historically redlined, we provide that here, which can help explain community conditions even today. We have a measure of diversity, and we also have a measure of diversity of electeds. That's a county level measure that tells you really, do the electeds, are they representative demographically of the population as a whole? So there's a lot of good contextual information here. And this is really just scratching the surface of the kinds of data that are available in HPI. Our HPI data by themselves can give you a rich picture of the community conditions on the ground, but we also offer hundreds of what we call decision support layers. So these are other measures of community conditions, population factors, health outcomes, climate change exposures and risks. And these are all available in our View Indicators tool. So even if you don't end up using the HPI score itself, you might find a lot of other helpful information in our decision support layers. So for example, you can get measures related to extreme heat. We also have population and sea level rise in inundation areas, right? And you can start to see how you can provide more information about this community beyond the HPI score itself. We're pulling in data from all different kinds of data sources here. So in a lot of ways, this is kind of a warehouse for all kinds of data related to populations, health outcomes, and community conditions, even beyond HPI. So I strongly recommend that you check this out, even if you don't end up using the HPI score. And this is going to be important in just a minute, but I also want to share that we have other indices of disadvantage actually available within the HPI map to view. So even if you don't use HPI for a grant application, but that grant application also says you can use CES, you can actually look at the CES data right here on our tool also. This makes it easy, for example, to compare which communities might pop up on HPI compared to CES. You know, we also have the Social Vulnerability Index, we have low-income households. So again, even if you don't go with HPI, all of these data are available on the HPI tool. All right. So let's actually put these data into action, right? Many grant programs in California use HPI as a key criteria for evaluating need. And a lot of funding programs are going to give you multiple options to justify that need. So those things might be CES, might be HPI, might be median household income, for example, lots of different ways that we can justify or identify need. So let's talk a little bit about how you would actually use a tool like HPI directly in your grant application. So just for illustrative purposes, I'm going to use the Clean California Local Grant Program as our example today. So it's kind of a three-step process. One is reviewing the grant guidelines to understand them better, assessing your project area, and then writing the justification. First up is reviewing the grant guidelines. So you'll want to download the guidelines for the funding opportunity and take a closer look at those places that are talking about eligibility. So this, for example, is the Clean California Local Grant Program guidelines. And you want to look in the places that are things like that give you information on eligibility, anything around underserved communities, disadvantaged communities, vulnerable communities, etc. This is going to tell you what this funding opportunity is looking for in terms of an underserved community. So I'm going to go ahead and click on this here. And we can see, based on these grant guidelines, that an eligible project should be fully or partially located in an underserved community, demonstrate a direct benefit to an underserved community, and at least 75% of the population surrounding the project sites must be underserved based on one of the below definitions. So most of your grant applications that have a requirement like this will give you their definition for what an underserved, disadvantaged, vulnerable community is. And with the Clean California Local Grant Program, they actually give you a bunch of different options. So here we've got area median income, CalEnviroScreen, National School Lunch Program, the Healthy Places Index, as well as Native American tribal lands. So really your first step, look at the guidelines, figure out how they are, if a community needs to be underserved, vulnerable, or disadvantaged in order to receive funding for this project, and then how are they defining it? And so it gives you these different options here. So what you want to do is actually kind of go back to that conversation that we had earlier about choosing the right index tool for your work. You can use HPI in this case. You could also use CES, but think about picking an index that really matches the kinds of work that you're going to do. So if you're looking at mitigating pollution burden, use CES. If you want to impact community conditions more broadly, kind of looking at those upstream factors, maybe you want to use HPI. So, take a look at those grant guidelines, figure out what your options are, and then pick the option that really aligns best with the kind of work that you're doing. And if it turns out that HPI is the right fit, well, then you can move on to step 2, going to our online map and getting some information about HPI. And even if you don't, and I mentioned this earlier, but I'm going to say it again, even if you don't use the HPI score, a lot of those indices and indicators for evaluating need, for identifying underserved or vulnerable communities, they can also be accessed through our HPI map, like I just showed you. CES is there, SVI is there, we have low-income households, etc. So this really gives you an opportunity for one-stop data shopping. So you can always just check out what data we have available, and it might have everything that you need right within the HPI. Okay, so you've decided that HPI is the right fit. So what's next? Well, there's kind of 2 options here. One, you already know where you are planning on citing your project. Okay, that makes things easy. Option 2, you might actually be looking for a community where you want to cite this project. So let's go back to the map again. And option 1, if you know where your community is, find it on the map, whether that's searching for it directly here, zooming into it, like maybe let's look at some of these communities here in City Heights. Click on the community and note down the HPI score percentile rank. So that's this information here, as well as its track number. These are kind of the two pieces of information that you're going to want to pull out. Now, maybe option two, maybe you're looking for a place where you want to actually site your project. And if the funding opportunity provides priority to vulnerable or underserved communities, or actually only will fund projects that will directly benefit priority, vulnerable, underserved, disadvantaged communities, then you're looking for those communities in dark blue. So again, that's HPI quartile 1. Most grant programs, including the CCLGP, that Clean California Local Grant Program, any community that falls within HPI quartile 1, below the 25th percentile, areas of dark blue on the map, that's an eligible community. So pick your community or communities, note down the HPI score rank, as well as the track number, and kind of keep that handy. It might be that your project area, for example, could be a bike lane that you want to put in, or maybe you're going to have multiple project sites that are related and they might cut across multiple neighborhoods. Well, what do you do in that case? Well, you could go ahead and submit the individual tract level data. So if you're maybe doing something across, these 4 or 5 tracks, you can provide the information for each of these communities. But it might also be helpful to recalculate the HPI score for your specific project area. And we have a function called the pool geographies function that actually lets you do just that. So I'm going to say that these 5 communities represent my project area. I'm going to pool them together. So I'm going to click this pool tracks button. All I did was click on them. It's going to take a minute because it is essentially recalculating the overall HPI score and all of the individual indicators for that group of tracks. So you've kind of created a specific HPI score for your project area. And you can go beyond HPI. And once this is finished recalculating, you can actually see any of our individual indicators at this project area level. So if you were doing a project that was looking that, maybe you're doing something that's related to diabetes or another chronic health outcome, you can actually get the overall diabetes prevalence for this entire grouping. So the pool geographies function is really helpful if your project extends beyond the boundaries of just a single census tract. You can pool them together, you can get an overall HPI score and percentile rank, and then you can also, for example, go to our view indicators and see, okay, I was saying health outcomes. Let's look at the proportion of the population just in this grouping of tracks where what the percent of the population has diagnosed diabetes. And you can actually get that information for the specific pool of tracks. So this is a little bit of a more advanced technique in using HPI, but it's so helpful if your project area might cut across multiple communities. So take a look at that. I also want to point out that I have a little mini tutorial on how to do this, including little animations, step-by-step, built directly into this presentation. So check that out and you can see how to do exactly what I just did. Okay. Also, I want to point out, and I showed with like the diagnosed diabetes, for example, you can go beyond the HPI score and using HPI data and tools to characterize the community that you're going to be serving with your project. So you can look at the overall policy action areas or those individual indicators, or even any of our decision support layers. Like say, for example, you want to look at some of the climate exposures that might impact it. Well, you can kind of get the overall community conditions, and then you can pull data on extreme heat risk for that community too. So feel free to go beyond the HPI and pull other data to help characterize your communities. Okay, last but certainly not least, you actually need to include these data in your grant applications. Most of your applications are going to have specific instructions for how to do this. For example, the CCLGP, so that's that Clean California Local Grant Program. They actually have a special worksheet that's part of their application that asks you to put in this track data to ensure eligibility, but also include it in your project narrative where it's appropriate to do so. And I went ahead and wrote up a little example sentence for how you might characterize a community. So I was just looking in the City Heights neighborhood, and you can see here, the proposed project will serve the City Heights neighborhood of San Diego. And I'm putting that census tract ID in there, census tract 2302. This tract has a percentile rank of 7.2, which falls within the bottom 25th percentile on the Healthy Places Index. And as we learned from the guidelines, what they're saying is that tracts in the 25th percentile or less qualify as a disadvantaged community based on this index. So you can use this form. Just give folks the tract ID or the set of tracts, the percentile rank, set of ranks, or pooled rank, and then make sure you're indicating, yeah, this is a priority community based on the HPI and based on the grant guidelines. This is really identified as a vulnerable community or disadvantaged community. I do want to back up, and because I've been saying things like underserved community, disadvantaged community, vulnerable community quite a bit, because this is the language that is used by a lot of funding opportunities and grant guidelines. The HPI finds a lot of language like that unnecessarily stigmatizing. And it's why we call our tool the Healthy Places Index. It's also why we use this blue to green color scheme, because blue to green doesn't have the same kinds of connotations as red or orange. We actually really didn't want to re-stigmatize communities. You know, for us, we call those communities in HPI quartile 1 priority communities, not disadvantaged or vulnerable communities. I'm using the language of the guidelines, but we ask if you're able to do so, keep the positive frame with HPI, because not only is it important around orienting us to opportunities and hopeful steps forward, but it's also a pathway to more directly engage communities. Communities don't want to be called disadvantaged or vulnerable. But if you want to go to the table and pulling data from the HPI, you can go in there in a way that is not inherently stigmatizing from the jump. So wherever possible, keep that positive frame. Remember to look both for community strengths, because every community has them, as well as those opportunities for improvement, which is really what we focus on with the HPI. That there are always going to be opportunities for improvement, and many of those can leverage the existing strengths in the neighborhood, whether it's things like, really like a large number of jobs, good tree canopy coverage, high school enrollment, uncrowded housing. Take a look at those indicators. There's always strengths that we can leverage in terms of building healthier, more resilient communities. All right. On that note, I want to make sure that we have a couple of minutes for Q&A. I've seen some questions come through in the chat. Before, I just want to give you just high level different ways that HPI has been used across California. It's really from everything from community health assessments and local health departments, safe routes to schools plans, climate resiliency assessments, and more. Because remember, a healthy community is a resilient community too. So don't overlook HPI and when you're doing your climate resiliency work, as well as many different other kinds of projects and programs. And we have our full list of use cases, which you can check out and download directly from this presentation. With that, let's go ahead and take a few minutes to answer some of your questions.
Do you want me to have some rapid Q&A, Helen?
Yes, let's do it.
Let's get into it. So, and again, if we don't answer any of these live, we'll follow up via email addressing these questions. First up, why are some geographic areas excluded in the HPI map, Helen?
Yeah, this is a great question. Okay, so you'll see on our map, some communities that have this crosshatched dark gray area. Actually, San Diego is a really great place to illustrate why some of these places are excluded. So we have inclusion criteria for the Healthy Places Index. Communities that have fewer than 1,500 people in them, or if more than half the population lives in like a congregate setting, like a university dorm, skilled nursing facilities, prisons, etc., we don't include them. And that's for issues of data reliability and validity. In most places, you'll see here, for example, we don't have HPI scores for the Coronado Naval Base or the San Diego International Airport. These are areas with industry. There's not a lot of population there. In some of the more rural areas, we might not hit the population threshold, but even if there isn't an HPI score for that community, many of our decision support layers will have data for that community, so you can still get data for it. And what we typically recommend is that for communities that do not have an HPI score, treat it as though it falls into HPI quartile 1. So treat it as a priority community. So that's our recommendation.
Great. And that addresses, we had a question specifically about rural considerations. So that got to some of that, and we can provide some more in-depth information on that question as well in our email follow-up. Another question for the pooled census tracts, what is the pooled geography being ranked against?
It's still ranked against the entire state. So you're still getting that percentile rank compared to all other communities in California.
Great. Thanks, Helen. Another question, how do we download the individual census tract data?
Okay, couple of different ways. One is that we have a form on our healthyplacesindex.org website where you can request our complete data file, which is all of our HPI score information. We also have a download portal through what we call our API, our application programming interface. Easier to use than it sounds. You can access this by creating an HPI account here, and then you can get an API key to download HPI data. And there's complete documentation on how to do that on the API website, which is accessible by clicking this link right here.
Perfect. Thanks, Helen. And maybe for our final question here, does the Alliance actively promote utilization by local and federal policymakers? Is there a report card of how leaders or agencies maybe are using the HPI?
Yeah, I think that's a fabulous question. We would love for more policymakers to use it. And we know, lots of local government agencies are already using HPI as part of their resource allocation and prioritization decision-making. And we also know that's being used by advocacy groups because they're able to take HPI data, which is essentially quantifying their lived experience, right? You go to any community, they already know those challenges and the issues that they have in their community, those opportunities for improvement. But HPI actually provides the data that policymakers want to see to help, say, people always want to make the data-driven decisions. HPI provides the data for those decisions. So HPI has been popular among advocacy groups and community-based organizations because they can use that data and then use it as part of their advocacy work with local policymakers. And to that end, if you're interested to learn more about our use cases, there was a link a little earlier in this slide deck where you can download kind of our full list of use cases, including those.
And I think given the timing, we can follow on the rest of these questions via email in the coming week or so.
Great. Thank you so much, Savannah, for providing moderation support. Really appreciate it. Just to wrap up, I have got key links and resources actually directly in this presentation. So feel free to visit these to go deeper, including our FAQs and some tutorial videos if you want to learn more about how to use our map. And of course, we're always delighted to hear from you. Is there ways that we can improve the HPI tool, more data and other things that we can provide to help support you in your work? So thank you so much for joining us today. I hope that this has been a really useful exercise for you to see how you can include HPI in your grant applications. And we'll be reaching out to folks soon with more resources and links to the recording. So thanks all and enjoy the rest of your day.